The link between diet and incontinence is an often overlooked but crucial area of concern in managing this common condition. Incontinence, which involves the involuntary leakage of urine, can be significantly impacted by what we eat and drink, and certain foods can exacerbate or even contribute to the problem. While many may not realize it, dietary habits can play a pivotal role in the frequency and severity of incontinence symptoms. One of the most alarming aspects of this issue is the widespread consumption of unhealthy foods that can irritate the bladder and lead to increased urgency, frequency, and leakage. High-fat, processed, and sugary foods are particularly problematic as they not only contribute to overall poor health, but also directly affect bladder function. For example, consuming large amounts of caffeine, alcohol, spicy foods, and citrus fruits can irritate the bladder lining, making it more prone to overactivity and discomfort. This can worsen symptoms for individuals already struggling with incontinence and contribute to a cycle of frustration and discomfort. Furthermore, an unhealthy diet can lead to weight gain, which is another major risk factor for incontinence. Excess weight puts additional pressure on the bladder and pelvic floor muscles, making it harder for individuals to control urination. This added strain can significantly worsen incontinence, especially in individuals who are already vulnerable due to age or other health conditions. The impact of poor dietary choices can thus be compounded by the physical strain of carrying excess weight, creating a vicious cycle that can be difficult to break. In addition to the direct effects on bladder health, a poor diet can contribute to underlying health conditions such as diabetes, which are themselves associated with an increased risk of incontinence. Diabetes can cause nerve damage that impairs bladder function, and individuals with poorly controlled blood sugar levels may find that their incontinence symptoms worsen over time. Similarly, conditions like high blood pressure and heart disease, both exacerbated by unhealthy eating habits, can affect the kidneys and bladder, further complicating the management of incontinence. Perhaps the most concerning aspect of this issue is the lack of awareness surrounding the role of diet in incontinence. Many individuals may not realize that the foods they consume are contributing to their symptoms. Often, there is a tendency to focus solely on medications or surgical interventions to manage incontinence, while dietary factors go largely unnoticed. This can lead to prolonged discomfort and dissatisfaction as individuals struggle to manage their symptoms without addressing the root causes related to nutrition. Moreover, the food industry often exacerbates the problem by promoting products that are laden with artificial additives, preservatives, and high levels of sugar and sodium. These ingredients can be harmful not only to bladder health, but also to overall bodily function, leading to a range of additional health issues. The pervasiveness of fast food, processed snacks, and sugary beverages in modern diets has made it increasingly difficult for individuals to make healthy dietary choices, further contributing to the rise in incontinence cases. The negative impact of diet on incontinence highlights the need for greater education and awareness around the role of nutrition in managing bladder health. By avoiding certain irritants and incorporating more bladder-friendly foods into their diets, individuals can reduce the frequency and severity of incontinence episodes. Yet, without proper guidance, many continue to make dietary choices that exacerbate their condition, ultimately compromising their quality of life. In conclusion, the relationship between diet and incontinence cannot be ignored. A diet rich in unhealthy foods, combined with weight gain and underlying health conditions, can significantly worsen symptoms and make incontinence more difficult to manage. It's crucial for individuals to take a proactive approach to their diet and consider how their food choices might be affecting their bladder health. However, with a better understanding of the link between diet and incontinence, it's possible to make more informed choices and ultimately improve the management of this condition.